The Local Show, sponsored by Victory in Motion, home of knee repair, not knee replacement, on News Radio 570 WSYR, on 106.9 FM, and live everywhere on the iHeartRadio app. The Local Show features in-depth conversation with business owners, employees, and influential business leaders throughout Central New York, exploring their successes, challenges, and reasons for doing business right here in our growing community. The Local Show is produced locally by Zoe Advertising. Now your hosts, Tom and Steve.
We're back at it again. This is The Local Show. Welcome in, in the doldrums of winter. Nice and cold. I've had to turn the heat up in the house, which is rare for me because I don't usually like it, hot.
Is Kelly like hot, cold, or
she has to have it, warm.
Okay.
And so she's always fighting with me. Now I've said to her, hey, how do you feel? Because I'm going to turn the heat up. She's
right.
Like, well, I always want the heat up, so go ahead and turn it up.
I went by Mom's house last week. She had her shower head was leaking, and she bought a new one. And at the extent of my skill set, I replaced the shower head.
Very nice.
That's about as far as it goes for me. Anyway, it had to be 100 in there. I walk in,
wow.
I look,
That's
like,
too much.
I look at it was like 76 or something. I'm like,
God.
But
about 71 is my tolerant level. Yeah. Kelly could probably do 74 in the house, but
Yeah, I grew up in a house where heat cost money, so you always turned it way down.
Yeah,
at least back then it was, the whole, don't leave the window open, shut the door.
Well, according to all the sleep specialists, they say you got to go very cool at night.
Really?
Yeah, cool at night, and that gets you the best sleep.
I don't know. If there was only a doctor to know, because they're supposed to know everything.
Well,
they're a doctor. They
Don't
went to school for 50 years. Hey, look,
yes, Dr. Marc Pietropaoli is with us right now, and he brought a patient along with him, and her name is Lorraine. They're both from Victory in Motion, home of knee repair, not knee replacement. How are you there, doctor?
I'm great. How are you guys doing?
Good. How are you, Lorraine?
Great.
Do you feel comfortable even though you're next to Steve?
Absolutely. Absolutely.
Most people run out of the room by now, but
it's true.
Glad you're sticking around. So, doctor, let's talk about what you do, what you've done in the past, and what your practice has morphed into. So let's start there, and then I got a question for you.
All right. First of all, I turn the heat way down.
Yes.
Nice and cool.
Very nice. Very
you
cool.
do sleep better. You do sleep better in the cooler temperatures. So that is a well-known fact. And the more sleep you get, the better you feel.
Yeah, the deep sleep. What do you think? About an hour and a half at our ages?
Right.
No, an hour and a half of deep sleep.
REM
is
sleep?
Good.
Yeah, I'm not a sleep doctor. So let's talk about what I do.
Well, we'll let you do your thing then.
Doctor, my knee hurts when I sleep. What should I do?
All right, well, I have a great story for you then. Lorraine is Italian, so you're surrounded by Italians.
Yes,
right?
I am.
She's an amazing cook, but I had the privilege of going to medical school and doing my orthopedic residency with Lorraine's daughter, Chris, who is an orthopedic surgeon, sports medicine down in Maryland, correct?
Right.
So that's our connection going way back. But I have listened to your show the last few weeks, and I just want to make some slight
corrections of what we said. Yes.
Yeah. So I'm still an orthopedic surgeon.
We didn't say you weren't. We just said said that you've shifted your focus.
Right.
What he means is some slight corrections to what Steve said. And that's fine.
1,000%. So you've been saying, Steve has been saying that here is a surgeon who doesn't do surgery anymore, and which isn't 100% true.
Okay.
I do perform minimally invasive surgery, arthroscopic surgery, little tiny poke holes.
Right.
And Lorraine has been the recipient of that, as well as the biologic procedures like the stem cells and the PRP, platelet-rich plasma, which the growth factors in our bloodstream, which can help our bodies heal ourselves. But I do not perform knee replacements anymore, and that's a definite. I haven't done that.
Okay,
since
YouTube listeners will see that the doctor is making direct eye contact with me to correct things I've been saying. So he's got it going right here. So yes, got it. You're still a surgeon. You do little poke hole things sometimes, but you would way rather restore people's knees without invasive surgery.
Yeah, who wants surgery if you don't need it? Like I've had 5 surgeries. You don't. So we focus always on non-operative first. And I learned that especially during my fellowship with Dr. Andrews, who is like the greatest of all time, the GOAT of sports medicine down in Birmingham, Alabama. Your medical school is 4 years, residency is 5 years in orthopedics. That's a long time. And I did that in Syracuse, and we got to be really, really good surgeons. We did a lot of surgery.
Right.
But when I went to Alabama for my sports medicine fellowship, because to specialize in hand surgery or sports medicine or back surgery, whatever, it's usually an extra year. That's called a fellowship. So I worked with Dr. Andrews really, really closely, and he is the greatest of all time. If you've ever watched ESPN, you've probably heard his name. You know, Roger Clemens, John Smoltz, Bo Jackson, all these really top professional people.
Yes.
And then he also had a physical therapist, Dr. Kevin Wilk, who worked with him, who worked on the whole body as opposed to, let's say it's the shoulder. We're only going to work on your shoulder. Well, these baseball players, you got to work on their legs to help their arm. And so I learned a holistic approach, and I always learned, don't operate first. Try everything you can try without surgery first. And then if you need to do surgery, you can do it. But that's where I started to learn all these minimally invasive or even regenerative medicine techniques.
Right. As far as the regenerative is concerned, is it easier to work with patients who are younger? Are the platelets in your body easier to or more powerful when you're younger?
Super question. So for PRP, platelet-rich plasma, where the platelets are those little things when you cut yourself, you form a scab, they stop the bleeding so you don't bleed to death, and they release growth factors that help your body heal itself. When you're younger, those are better. So sometimes you can, quote-unquote, get away with doing, quote-unquote, just PRP in someone who's maybe in their teens, 20s, 30s. Once you get into your 30s, your platelets are still good, but they're not quite as good. So it might take more than one shot, 2 or 3 shots. Whereas when we use cell therapy, stem cells,
Yes.
it doesn't matter what age we are,
Oh, it doesn't.
your stem cells
Good.
are still really good in your pelvis and in your spine. As we get older, we have less and less stem cells in our arms and our legs, and that's why they start to break down more. But
Gotcha.
the cool thing is we can take stem cells from a good area, the pelvis, which is right underneath the skin, and Lorraine knows all about that.
Yep.
And we can concentrate those, and we can put them in an area where there's not any, where there's not as many good stem cells anymore to help that area heal, which is like reseeding the area basically. It's
Gotcha.
like, taking good cells and putting them where the, where there's not enough good cells
So
anymore.
not just knees. I know you do an awful lot of knees, and that's.
Well, he mentioned hands, and I wanted to know about that because I never had problems with my hands, but as of late, I think because of the computer, do you see a lot of people with like Jones contracture and all that stuff?
So to answer both questions, Gary, who was just on, he was saying he has a problem with his shoulder. So yes, he asked, what other joints do you work on? Mm-hmm. And absolutely, knee repair, not knee replacement came from, I'll tell you that story at some point. Yeah. But that was the original thought in my head. Hey, I want to figure out a way to repair a knee instead of replace it. And I thought of that in 1992, and that's a whole different story. Okay. But all those principles apply to other joints like the hands or the shoulders or the hips, even the back and the neck. I don't really deal with injections in the back or the neck, but any other area of the body, yes.
Okay, because there was a time, and I think maybe even in the 80s, well, in the 90s, where people seem to be getting the what do you call it? Carpal tunnel.
See, well, he's pointing to his basal joint, which is this joint at the base of the thumb called your basal joint, and that tends to wear out because we use our thumbs a lot, right?
Right, yeah.
That's what makes us human. And so that joint wears out a lot. That's a great joint for regenerative procedures. Now, carpal tunnel also is good for that as well.
Sure.
We can prevent surgery a lot of times when people think they need surgery for carpal tunnel.
That was awful. There was people were getting dual, carpal tunnel surgeries and walking around with Band-Aids everywhere.
It's hard to do both at the same time because now you don't have a good hand. And
we
have hygiene things we have to do. And so it's hard to operate on two things at the same time, surgery-wise. Now, you can do both hands for a regenerative procedure and
no problem.
There's no incision.
It's
just little.
So if someone has been sent down the road of you're going to need a knee replacement, you're an alternative to that, or maybe an alternative, or you should at least have a conversation.
I mean, honestly, we think we should be the first alternative because you should always try everything you can try before surgery, before doing it. I mean, my father got hip replacements, and 9 years after his hip replacement, he got an infection in his hip. So you can still, once you get that metal, plastic, and cement, there's no turning back.
Right.
And you can get an infection in there even years down the road. It can come from your teeth or a urinary tract infection or a hangnail. So that was a tough personal experience that I went through, but that is always a risk. So, I always learned, try not to do surgery first and see if you can get them better without it. And if they need it, I still do it.
Okay. So let's carry you guys over the break with Lorraine. So Dr. Pietropaoli, Victory in Motion. Phone number 685-7544. if you want to ask some questions.